early symptoms of cardiovascular disease, one of the most common ones is shortness of breath. Okay, now that can be an early symptom or it can be a late symptom. And if you ever want your provider to take you serious about cardiovascular health, if you have shortness of breath, make sure you tell them, because that creates a whole series of further questions and investigation. So it's very, very important. Elevated cholesterol sometimes can be an indicator, a great metric to follow. But as I mentioned in the previous lesson, 50% of all heart attack and stroke victims have normal cholesterol. So cholesterol isn't a good metric by itself. But if something's going on, it can be a great metric to follow if you know something's going on. Hypertension, blood pressure is a very important marker to really pay close attention to. In my clinic, if I see anything wrong or any questions about cardiovascular health, I get people to monitor their blood pressure 2 times a day, earlier and later in the day, in the same patterns that they do things, not necessarily the same time, but an AM reading and a PM reading, and keep following with that. Normal, or I should say high blood pressure is anything 130 over 80 and over. So 130 over 80 or higher, that would be hypertension, high blood pressure. Normal blood pressure, and these numbers have changed in the last decade, but normal blood pressure is seen as anything as 120 over 80 or under, right? That's seen as normal. Also, another indicator is elevating resting pulse. So lots of things can cause elevated pulses, but a resting heart rate over 100 beats per minute or equal to 100 beats per minute, that's what we call tachycardia. And tachycardia just means abnormal high heart rate, at least 100 beats per minute or higher. At rest, that is not good. That needs to be figured out. Swelling of ankles, there's lots of causes for swelling of ankles, but when they swell consistently, and sometimes people have really significant indents in the sock line. Some people are given compression socks and all these different things. That can mean a few things, but one of them can mean blood pooling, that the heart is not doing what it should, pumping back through, or there's vascular damage where the valves in the veins and are becoming insufficient and they're not able to hold the blood, so it starts to pool and it can stretch the skin and actually create discoloration of skin. Lower extremities are an important thing to pay attention to. Another one that's not so common, but it's an early symptom, and that's reduced brain endurance and stamina. Sometimes people will blame things on brain fog, and you really want to pay attention to cognition and mental functioning after medications are given, specifically low blood pressure medication or medications for high blood pressure. Because what happens with this is sometimes blood pressure medication can be too potent, and you lower the blood pressure so much that the heart isn't able to pump up to the brain, and your brain runs out of oxygen, and it creates all sorts of abstract things. So sometimes brain problems can be an early indicator of cardiovascular problems or even medications that are maybe not dialed in properly. So you always want to talk to your primary about that or your cardiologist about that. This is just one clip from our cardiovascular course. Click below to access the entire version.